Hi, my name is Jason Edwards, and this is episode 1, and I'm interviewing Mark Fesler, a medical oncologist at St. Luke's. This is called Doc Discussions, and it's brought to you by the Friends of St. Luke's. So, Mark, good to see you, buddy.
Thanks, Jason. Good to see you, too.
Thanks so much for coming. I know you're busy, and it means a lot to us to have you here.
Absolutely. My pleasure.
So, we've known each other a little bit, but I actually don't know you too well. Where are you from originally?
So I was born and raised in De Pere, Missouri. So
Yeah.
just in the neighborhood, really.
And was most of your education here in St. Louis, or did you travel away at any point?
Yeah, so, grade school, high school, college, medical school, all the way up until internship residency was here in St. Louis. Escaped St. Louis for a short period of time, Denver, Colorado. And my wife and I, our families are from St. Louis, so we decided to move back for fellowship, and then have been at St. Louis U and decided to transition to St. Luke's here in the last year.
Very good.
Yeah.
And so you're at the University of Colorado.
That's
in
right.
Boulder?
That's
Yeah.
right.
Yeah. I've been out there a few times at the university, but the university is in Boulder and the medical campus is in Denver, right?
Yeah. The Health Science Center's in Denver. So yeah, that was they actually switched locations when I was in my training. So it was in Denver and now shifted to Aurora.
Okay.
Colorado,
And
yeah,
that's just a
eastern suburb, yeah.
Got you.
Yeah.
Yeah. And a beautiful state, and a lot of people are very active when they're in that area. Do you work out? Are you active?
Yeah, I run and lift weights from time to time, and Colorado afforded some nice mountain biking and skiing opportunities. So my wife and I both, snow ski on occasion and whatnot. So yeah, it's good.
Yeah, that's good. I try to lift a little bit, and there's kind of different avenues that you can go down. Are you like the standard 3 sets of 10? Or are you a power lifter, or what kind of stuff do you do with that?
Lots of reps,
Okay.
nothing too heavy.
Yeah.
Just avoiding kind of injury and mostly getting cardiovascular type stuff in and
Yeah.
trying to not put on too much bulk.
Yeah. I have that problem too. Always just getting massively strong, but I'm able to do my best and stay lean. One thing I think that I always say is your blood flow is your health, and I truly believe that, whether it's your brain or your heart. And I was reading, and people think, oh, you're a doctor, you know for sure this works. But we know our own specialties, but everything else you kind of understand somewhat, but probably just know enough to be dangerous, as
Sure.
they say. But they were saying that the more just skeletal muscle mass, that really serves as kind of a sink or a capacitor for times when you have elevated blood glucose. The skeletal muscle through the GLUT4 transporter will really take up a lot of that glucose and keep the high sugars from damaging your vessels,
Sure.
which is good for your heart health and your kidney health and your brain health.
Sure.
So I think lifting and developing skeletal muscle is good for a lot of reasons, just for the structural integrity, but also it helps your other organs. And then there's an old saying, get out of your mind and into your body. It kind of keeps us sane too.
Sure.
Yeah.
It's probably good for the bone marrow too, which we know is the most important organ.
And is it really? Is there some good data on that it helps with the bone marrow?
Oh, I think that it's just a joke, but I think that ultimately, getting cardiovascular fitness in, whether it's weights or walking or running or cycling or whatnot, it's going to help with generating blood production and
Yeah.
that type of thing, and
Yeah.
the red blood cells are key for oxygenation and that type of thing. So yeah.
You bet. There's an old saying, this old rustic said, I wish I knew where I was going to die so I would never go there. And it's kind of a funny thing, but when you think about it, it's kind of a smart statement too. It's like, and me and you in our jobs, we see people at all stages of life, and you see what can go wrong with the body. And some of that, like hematologic malignancies, you don't have a lot of say-so. It's kind of an unlucky lottery. But a lot of things, whether it's dementia or heart disease or diabetes, you see it's very apparent what you want to really avoid.
Yep.
And I think exercise is a huge thing in kind of not going there.
Yeah.
As the rustic said.
Yeah.
What other hobbies do you have?
I like spending time with my family. My kids are involved in a bunch of sporting activities and those sort of things. So I've got all the sports covered. Swimming, water polo, hockey, soccer is what they're all involved in. So I enjoy all that stuff. I myself was a soccer player back in the day. So
yeah. And if you're from St. Louis and you're a young man, I mean, there's a decent chance you were a soccer player.
That's right. Yeah, soccer's big in St. Louis.
Yeah, and where did you? I'm not from St. Louis, but the big thing in St. Louis. Where did you go to high school?
Yeah, that is big. So I'm a junior Billiken. I went to St. Louis U High.
Okay.
So
yeah. They have pretty good sports teams. Is that right?
The junior Bills have really good sports teams. I'm going to put a pitch in for them right now. They're in the Metro Catholic Conference. We usually take down the other schools. Now it's some good healthy competition with the other boys Catholic schools in St. Louis. So yeah.
You're a busy guy. You run a busy clinic, and then with your family. I mean, there's not a lot of extra time, I would assume. But do you ever find time to read at all?
I do read. I actually have, outside of medical reading, I've kind of acquired that skill actually just in the last several years. It's been, it kind of helps me divert my mind from, just the reality of what we're dealing with on a daily basis. I find that, turning that screen off at night really becomes valuable in terms of, getting your mind on a completely different subject. I tend to prefer fiction type things, and I find that it really helps facilitate rest at night. So yeah.
Do you have a favorite book or a favorite author?
Oh, I mean, I don't think that I've got anyone in particular, but just getting removed from reality and kind of getting out there in the fictional world has been helpful.
One of the things that I hear a lot in clinic is patients will say, "I can't sleep. I have a hard time sleeping." And I think as time goes forward, that will be a huge, and it's starting to gain some more notoriety, but that will be a huge area where people will improve their health and quality of life by focusing on their sleep. And a huge part of it, as you know, is on your phone, there's a blue light behind it, and that blue light's telling, I think your pineal gland, I may be wrong.
Sounds about right, yeah.
The pineal gland, it tells it to wake up. And the same thing's on your TV. And you'll ask people, do you watch the TV at night? And they'll, oh, sure. And then you'll say, well, you got to stop watching the TV and you'll sleep better. And then nobody wants to do it, of course, and because we're all kind of creatures of habit, and I'm the same way.
Sure.
But have you looked into that a little bit? And there's, some health benefits to reading and not looking at the screen.
Yeah, I think that, getting adequate rest and, how that's defined. I think that probably most people would say, ideally in the order of 7-8 hours of sleep each night for an adult is ideal. And then, my patients have sleeping difficulties sometimes that, span the spectrum of different types of issues. And, is it pain? Is it feeling anxious in the night? Is it I'm up, a lot to urinate and those types of things. So, I kind of try to work through that with history and, I'll suggest maybe increasing activity during the day, avoiding screens at night. And if those simple measures are exhausted, occasionally we'll resort to adjunctive measures that help in the short term with sleep, but I don't like, using medications a lot to help with sleep just because they can have implications for, ongoing, memory and addiction and those types of things moving forward. So
I agree. I think there's a lot of non-pharmacological things that you can do to improve your sleep.
Absolutely.
A lot. And I think the WHO, I think this is right, the WHO, the World Health Organization, made working third shift an independent risk factor for cancer. And there's a lot that can go into that.
Sure.
Like you may be more likely to smoke if you work third shift, but sleep has a strong effect on the immune system, which especially over the last 10 years, we've really come to realize that has a huge impact on treating cancers and cancer response rates, and so much so that a lot of the new drugs use the immune system itself to fight the cancer.
Absolutely.
And I do think the more people focus on their sleep health or sleep hygiene, the better their lives will be and the healthier they'll be.
Yeah.
And if you can use non-pharmacologic measures like turning the temperature down in your room, or staying away from lights, blue lights especially, for a few hours beforehand. That can really improve the quality of your life. But like anything that's worthwhile, it takes work to do it.
Yeah, and you brought up a key subject, the immune system. I mean, these days with, COVID pandemic and,
Yeah.
Using the immune system to increasingly attack cancers. I mean, us oncologists really have to think like immunologists these days in terms of, both preserving the immune function that a patient has, restoring that function, and then at times harnessing that immune function to actually defeat the cancer. And there's, a wealth of development in the field of cancer now. I mean, CAR T-cell therapy, there's bispecific antibodies now, coming about, and these medicines are really just trying to harness a patient's own immune system to go after the blood cancer cells, which I think is going to be a huge win for, patients and families. I think the side effects from these treatments, they are still, some side effects to deal with, but I would say in the long run, using the immune system rather than destroying the cancer with chemotherapies and some of the older treatments, I think that's going to be really beneficial for folks moving forward.
The immune therapies have been a beautiful thing because as cancer doctors, a lot of the patients, the majority of our patients, we treat and cure from cancer, but some of those patients, they have metastatic disease or disease that can't be cured but can be treated, and sometimes for many years. And with those patients, our goal is to improve the length of their life and the quality of their life. And the immune therapy is kind of a rare instance where there's not a ton of side effects and it improves the length of their life. So they not only get more time, but good time.
Absolutely.
Which is so important.
Absolutely.
And it is exciting, especially in your area, the hematologic malignancies, with the CAR T therapy and what's to come and what's on the horizon. And we never want to peddle false hope to our patients, but I mean, that's something that we could really, have some legitimate hope on, that we could kind of continue to get better and better. With COVID, people have kind of become more familiar with the scientific method and this and that, and the immune system and antibodies and stuff like that over the past few years. But one thing as scientists that we always have to recognize is that there are limits to what we currently know. And every once in a while you have a breakthrough like this CAR T-cell therapy that just opens up the door, and we'll keep slugging it out day after day, or not we, but the scientists will, and continue to have better and better outcomes. But really the heme malignancies really have seen incredible growth, over the last 50 years or so.
Yeah. So, there's probably about 5 to 10 new medications that get approved every year for, just even blood cancers themselves.
Right?
Yeah. And then, the way that we have to think as cancer docs and, immunologists is just, some of these treatments, they utilize the immune system to attack the cancer, but then they can also deplete the immune system as well. So CAR T cells are basically a patient's own immune cells. They get sent to a manufacturing facility. They come back genetically modified with a cancer-fighting protein. They get reinfused in the patient. And those cells actually can deplete a patient's B cells, but actually kill the cancerous B cells. So by depleting the normal B cells, there's some untoward, consequences of that. Patient can't generate antibodies. And so then we got to think, what's the next steps in terms of protecting them from all the viral and bacterial and fungal challenges in the environment. And it becomes critically important then to, consider replacing immunoglobulins for those patients. And then if they, are unvaccinated for COVID, or they lose their, response to COVID, then, it becomes important to consider other products that bypass the need for the immune system responses, products like Evusheld monoclonal antibodies that, can prevent COVID. So there's a lot to think through these days in terms of optimal protection for the patients, not only from their blood cancer, but also from all the challenges in the environment, particularly infectious challenges.
When we're treating patients, there's a lot to consider. It's the patient in front of you, their quality of life, their own value system, which could be the same as ours, but could be different. What's currently going on in the world, and And I'm glad we got smart guys like you that are there for our patients to take all that and put it together and figure it out, because it's not an easy math equation to put together.
I appreciate that, Jason, but you play a key role. I mean, it's just, the form of therapy that you give, radiations really can be immediately impactful for some of these cancers, and we saw this actually a couple of times this week when we've been collaborating. Somebody with an eye issue related to, a blood cancer near the eye. We saw someone with a spinal issue causing tremendous back pain and reduction in quality of life, and having radiation applied to those areas to obtain really rapid control of the cancer becomes critically important. So appreciate your collaboration.
Yeah, I'm just like a man with a hammer. Like if you come in, you get radiation, and you keep going. You have like 20 different arrows and like all kinds of weapons to use against the cancer. So, I've got a question for you about, and it may be off topic, but I've got you captive, so I'm going to take advantage of it. How much of a role do you think the thymus plays in children fighting COVID?
A challenge, not being a pediatrician, but interested in immunology. I would think, thymic production and development is still active in kids, and so...
And not in adults,
That's
typically.
right, that's right, yeah. So I would think the thymus is going to play a fairly important role in control of COVID. I think that there is some debate about whether the B cell or the T cell arm of the immune system plays a more critical role for protection and response to COVID vaccines. There's neutralizing antibodies, so primarily the B cell arm of the immune system that some people think is more protective. I think that T cell responses, the overall orchestration of the immune system may be important. The thymus is generally more involved in kind of the T cell arm of the immune system. So I would say that it probably plays a pretty critical role.
I've wondered if that was, there's several reasons why kids could be less effective, which they certainly are. From COVID-19, but I'd wondered if if that was a part of it, or maybe kids have so many viruses that they're all maybe kind of have antibodies that are close enough to the current COVID-19, and that this kind of comes back to the limits of what you know. It's kind of like your best guess at this point.
Absolutely,
we don't know, but it kind of adds up that may be a one of the things that helps young children get COVID and really deal with it in stride.
It is a little hard to understand why, we think of kids' immune systems maybe in some ways, even though they're perhaps a little bit more naive, it's going to be a little bit more active immune system, maybe a little bit more, cytokine, chemical messenger, let's get amped up against this infection type of thing. Maybe the older immune system, the cells just aren't quite as active, but the reason many people die from COVID, and it preferentially hits adults, is this cytokine release phenomenon where these chemical messengers are just going haywire, and it's not necessarily the virus itself, but it's actually the body's immunologic response that's killing them. And why that would be more in adults than kids, I think, is one of the paradoxes, and something that I don't know that we've got a good handle on, to be honest with you.
I'm happy to hazard a guess. I think that I know that as we age, our blood flow and becomes impaired, and children can develop streaks of atherosclerosis in their arteries, but not to the same extent that adults do. And if you have good blood flow to your kidneys and to your heart and to your lungs, you're going to be able to withstand an insult a little bit better than if those organs are compromised to some degree. And so I think that's at least a piece of it, is
Sure.
that when your body is challenged by that cytokine storm, if all your organs are working perfectly, you're probably going to get through it. And that kind of goes hand in hand with the data on the comorbidities too. If you have multiple comorbidities, then you're more likely to have a tougher time with
Sure.
it. Which in a way is all the more reason to keep your mind and body as strong as you can. So when you face challenges in life, whether it be COVID or a cancer or a broken leg or whatever it may be, you're able to get through that. Or psychological challenges. If you keep your mind as right as you can, when you face those challenges that we all inevitably will face, you're able to get through those obstacles.
Yeah. And to draft on that, I think, one of my main interests is bringing specialized blood cancer care to a community setting. So St. Luke's, not being a transplant or cellular therapy program, it does require a certain degree of youth and good organ function to accept some of the more toxic type treatments, bone marrow transplant, CAR T cells. But some of the newer immunologic approaches against blood cancers, these bispecific antibodies, they have much lower rates of some of these toxicities like cytokine release syndrome and neurotoxicity. And bispecific antibodies look like they're going to play a role for people who may have comorbidities, who are older and that type of thing. And so that's one of my main interests, is in kind of extending those often effective immunologic treatments for blood cancers here in kind of a community type setting where the patient population, is still informed, maybe still in decent shape, maybe don't even want to drive down into the city to, get a bone marrow transplant or CAR T cell, but we've got that option available, like bispecific antibodies, to treat the cancer.
To improve the length of life and quality of life.
Absolutely.
Yeah. Or at least prevent a decrement in quality of life while improving the length of life.
Yeah.
It really is a beautiful thing because a lot of life is taking in each day and having as many good days as we can and trying to optimize things the best we can.
For sure.
Yeah. Well, Mark, do you have anything to add today? Or anything off the top of your mind?
I think we've been pretty comprehensive in our coverage, Jason.
Well, world
a lot of thought-provoking questions, so I appreciate it. Yeah.
Well, thanks so much for your time. And again, this is Doc Discussions, brought to you by the Friends of St. Luke's. And if you hung in there all the way to the end, we appreciate you. Thanks.